Why specifically regenerative medicine? What is that in the first place?
After 20 years old, our body starts breaking down 10%. With regenerative medicine, we're talking about prevention. So when you get older, you don't have those problems. I think of it as getting a new you.
Wow. Hey everyone, welcome back to the Nikki Mungues Show. And I'm so excited because I have a super amazing guest today. He is going to be sharing with us so much information on regenerative medicine. And I'm so excited to bring on Mr. Adrian Rojas.
Hello, Nicole.
Hello.
Hi. Thank you for having me on.
Thank you for being on my show. I met you last week through Sarah Buzz, and you guys, he actually bought my product, my rainbow machine.
I did. It works.
Yeah, and I'm just so happy that you loved it. But we are so excited to learn more about regenerative medicine. So what got you into medicine in the first place?
Well, when I was a kid, I knew that I wanted to do something with medicine, just something in me. I don't know, it was natural, born in me, I think. And I knew that it had to do something with helping people, just like most typical, doctors and PAs, we want to help people.
Yeah.
And so I knew that was my calling just very early on in my life.
Yeah, I love that. But why specifically regenerative medicine?
Well,
what is that in the first place?
So regenerative medicine is a field of medicine that deals with repairing, replacing, and regenerating cells, tissues, and organs that can help you have a normal body function. So rather than using traditional medicine, which deals more with pills and devices and such, this uses more biologics, which deals with stem cells, exosomes. And we also use traditional methods as well, but mostly we focus on stem cells and exosomes even.
Yeah. And you've been doing this for how long?
Approximately 12 years, about
Wow.
12, 13 years. I've been in medicine for 30, but
Wow.
halfway during that point, I realized that there had to be more to repairing the body than just giving pills and, that kind of stuff.
Pills, as in pain relief medication, correct?
Right.
And what other types of pills, I wouldn't say go against regenerative medicine.
No, I'm not against, traditional medicine. I mean, I use it all the time. I mean, I've been doing, regular medicine, like I said, for over 30 years now. But like I said, they have the limitations. I'll give you an example. You can give someone amlodipine or losartan or whatnot for blood pressure. But if you're not addressing the cause of blood pressure, for example, in the kidneys and such, then you're just basically blocking or hiding, I should say, the reason for them to have high blood pressure.
Wow.
Yeah.
That's actually really interesting because I know a couple people who do have high blood pressure.
Right.
And, I would have to, pick up their medication, but I wasn't thinking about, wow, that actually can affect like the kidneys.
Of course. So that's the thing about regular traditional medicine is that like most things, they have side effects.
Yeah.
And when we're using mesenchymal stem cells, exosomes and whatnot, because they come from, the human body, there's very little side effects. So as far as I know, there's no side effects.
Wow. So it's so crazy because I came to you and I addressed my knee pain.
Right.
And I told you that I've already had 2 knee surgeries, but I didn't know that stem cells have such a different approach. It's not just bone. It's not just tendon. It's not just ligaments.
Right.
I didn't know that it can also help with other, I wouldn't say sicknesses, but, like high blood pressure, even probably cholesterol or?
Well, maybe not directly, but indirectly by, helping the cells themselves and the vessels, the arteries and so forth to keep them healthy, bounding, pumping. So indirectly, possibly, but directly, could I say stem cells can help you for cholesterol? Not so. I don't want to, over-exaggerate the benefits, but obviously there are benefits in the cell structure of the vessels.
Now, what are most common treatments that people ask about? I know you've worked with athletes. I know you've worked with, people in their 50s and 60s. Yes. What is the most common right now?
The most common reason people come to me at this point now is mostly for pain. Pain relief, diabetes, those are the common things that people come to me. Blood pressure, of course, as well. Hair regeneration.
Oh, wow.
Women's hormones stabilization. But the most common, I would say, is anything with joint pain, pain in general, and diabetic control.
Okay.
Kidney function.
Okay.
A
So
lot of kidney function.
really,
Yeah.
wow, I didn't even think of that. So can we break it down? Stem cells, correct? So if you were to break this down to someone who is actually interested in, getting a treatment, how would you explain or break down I know you talked about exosomes,
Right.
like what is all of that?
Right. So stem cells essentially come from your own body.
Okay.
You have stem cells flowing through your body, but at some point they basically become what we call senescent, which is they fall asleep. They don't function anymore. So the name of my business is called Activated Stem Cells for a reason, because I use the proprietary method of activating them and helping them be active so they can work for yourself. That's one method. That's called the autologous method, using your own blood, your own repairing, system. However, that has its limitations because we don't have that many stem cells. As we get older, they tend to fall in quantity as well.
Okay.
You might have anywhere between 2,000 to 4,000 at most stem cells flowing through your body at any given point. Mesenchymal stem cells, on the other hand, come from cord, placenta, and those stem cells are called mesenchymal stem cells. And those stem cells are in millions of quantities.
And that's what you do,
and
correct?
That's what I do.
Okay.
So the mesenchymal stem cells are actually what we call sourced here in the U.S., in Florida specifically.
Okay.
And those stem cells are the ones that help to repair the stuff that your own body can't do. So we'll use those stem cells to help inject into the joints, your knee, for example, your shoulders, the spinous process on the sides, not directly into the column. I don't do that. You have to go to like a pain specialist for that. But there's so many benefits to it because they can pretty much convert into a lot of different types of cells in the body.
Wow.
And that's where the tissue regeneration occurs at the cellular level, at the tissue level, at the organ level. And that helps to bring your own body repair back to homeostasis, which means to your normal status, how you should be.
So is it kind of like an energizer of like your cells in your body, or is it just an add-on to the cells that you already have?
So that's a great question because most people will come to me saying, you know what, I'm tired, which is another thing that they actually come to me besides pain. I'm tired. I need me a coffee. I need my coffee, those kind of things. So what stem cells do, they go in and they repair by way of, we call it messengers.
Okay.
Chemokines, we also call them. Chemokines, what they do is they buzz around in your body and they call those stem cells to where they need to go. So whatever most faults that you have, the stem cells will go in and replace and repair. So they'll help you for energy. They'll help you for youthfulness, which is a process I was telling you earlier about how it helped me when I did it. Yeah, I did it myself.
Yeah.
And it was a youthfulness that I can't describe how and why, actually, because a lot of this stuff is relatively new, although stem cells have been around since the 70s that we've been discovering them. Even the 1800s, actually, they started mentioning them way back when.
Wow.
But when I started using them, like I said, on people, I noticed that. And that's what they report back to me.
Yeah.
The youthfulness. Never mind all the stuff that was going on in the background when it was helping repair their bodies.
Yeah.
Kidney function.
Wow.
I mean, I can help regulate their kidney function by measuring their GFR, which is their kidney function, before and after, and seeing up to a 30 to 40% improvement.
And how fast was that?
It took a couple of months.
Okay.
But imagine your kidneys start to work better.
Yeah. Yeah.
I mean, there's only one medicine that actually has been proven to improve your kidney function. It's called Kendra. And my respects for that medicine because it's great. It is a standard traditional medicine. But a lot of people, even nephrologists, aren't using it. And I don't know why.
Wow.
But I can tell you, stem cells are doing that.
Yeah.
And without the side effects of other medicines like Kendra, which is great, by the way. I'm nothing against Kendra. But that's what stem cells do for your body.
Wow, I love that. Now, I know there's so many benefits. And if somebody's like hesitant, let's say someone has high blood pressure or any type of pain, my question is, what makes it so safe? I know you said it's from Florida and all that. Someone who just knew they want to get interested in it. What makes it so safe? Like, what are some hesitations people have in getting stem cells?
That's a great question because even a lot of medical providers, standard, when medical providers, doctors, PAs, nurses aren't even fully aware what stem cells are because they don't really get taught to us in school.
Exactly.
Usually. I mean, they might brief through it, for 5 minutes and that's it. Unfortunately, because there's not a lot of information for the general public right now, except for forums like this. It has to basically be word of mouth. Someone that you can trust. There's no way right now, unfortunately, you have to trust your provider, whoever that might be.
Why do you think it's not a common topic right now, though?
I think mostly because it's the media's jumping onto it now. They're becoming more pro stem cell regenerative medicine. I don't want to get into the politics of pharmaceuticals and whatnot, but obviously there's got to be something with that as well.
For sure.
I honestly don't have your best answer for that. I mean, I don't really know why they're not bigger in the industry, but I can tell you what I've experienced. And my thing is that as soon as people find out about them and people hear about what it happened or what it did for their aunt or their mother or whatever, then they're all gung-ho about it and they're all pro about it. And then they start spreading the word. And that's what's happening right now.
I love
people
that.
Are finding out more and more about it and they're telling other people. And of course, social media and all this is growing as well. So people are finding out about it.
Yeah.
I mean, places like Panama and Guadalajara, you have TJ, but their prices are so exorbitant. They're unaffordable for most people.
Exactly. And the fact that, it does work and just learning from what you're saying, it's like, why aren't people hopping on this?
Right.
If you're taking medication and to treat high blood pressure, to treat all other sicknesses, I don't think patients are aware of what the medication can do to their kidneys.
The side effects,
Exactly. Now let's talk about, athletes, right? So I know, I actually was doing my research too. And I was like, wow, Kobe Bryant got stem cells. Luka got stem cells and they travel all over the world for this.
Joe Rogan is a big proponent of them.
Yeah, exactly. Exactly. So for me, in my case, for those of you that don't know, I actually tore my ACL twice. I think I only have like a third of my meniscus left. I've had a bone contusion. So I've gone through so much trauma and pain. And all I was doing was, obviously physical therapy, taking so many drugs to relieve my pain. And you and I were discussing, I kind of wish I went to you first, right? Because the fact that I tore my ACL was shredded, you guys. It was shredded. So when you tear your ACL, you have to have, a new ACL. So obviously, you know this. It's either I get it from a cadaver, I get it from my tendon,
your other side,
my hamstring, or I get it from my patella. So just real quick, I'm going to explain what happened. So I needed a new ACL. So they had to chip a bone from They had to slice a third of my patella tendon and also chip away a bone from my kneecap in order for me to have an ACL. So I've gone through a lot. And I had to do that twice on both knees. Okay. So I only have 2/3 of my patella tendon left on both of my knees. So hence why I always say I have so much knee pain because a third of my patella tendon is gone. So I talked to Adrian the day of my demo and I was like, look, I have so much knee pain. Like I'm really strong. I'm an athlete, but you tested me out and I had what? I had...
you had crepitus in your knee.
Okay.
You had mild inflammation.
Okay.
And obviously pain.
Okay. But you also did say I was on track for arthritis.
Arthritis, obviously.
Okay. And bone, what was it? Bone degeneration?
Bone degeneration.
Bone degeneration.
Cartilage degeneration.
Cartilage degeneration. So I got a lot going on here. And, for me, I still want to be active. I still want to be, that athlete that I was once before. And so how do you think that can help me with my stem cells?
That's a great question. So there's two aspects of this. One is you've already been through the gamut of the whole standard, surgery and, recuperation and whatnot. So you were a great candidate because you've already been through that. You've already had the ACL replacement. So because of the fact that you've already been through that, because you were probably gonna benefit from it afterwards, because of the fact that you wouldn't be a stem cell candidate initially. And that, going back, because if you have a complete tear,
shredded.
I mean, so you had to have that surgery.
Yeah,
but the
that's true.
post-op recuperation, now if you didn't have a complete tear, let's say you were probably a third, maybe half, I could have helped you.
Yeah.
But if it was complete, again, this is not magic.
Yeah. That's
This is not, I'm not going to make, wave a magic wand and help you, get better quicker. But there is the place for standard medicine. Again, I come from standard medicine. And that's why I can say that regenerative medicine works, because I have that ability.
Yeah.
I did do this for, orthopedic medicine and whatnot for 30 years. So I've seen both sides, and I can tell you both sides have their place, and it's great. But when you have someone who's on the border, on the line where they're like, maybe yes, maybe not, definite regenerative medicine.
Yeah.
And I have helped many people with that, because you do a little Wharton's jelly, which we didn't even talk about yet. You put a little bit of dexamethasone, lidocaine in there, and bam, you 1 month, immediate relief initially, but that's mostly because of the dexamethasone and the lidocaine. But the stem cells start working, and eventually, a year later, no more tear.
Wow.
And that has happened not once, twice, at least 5 times that I can think of in top of my head.
Wow. So
that's the level of repair that I'm talking about.
Got it. So it's kind of good that I did have that surgery.
Exactly. Yeah.
So now it's like kind of rebuilding my knee health.
Remember,
correct?
I told you, my goal for you is more, where are you going to be in 10 years?
Yes.
How damaged is your knee going to be after all the stuff that you've been through in 10 years? And that's what regenerative medicine does. It helps repair that. So when you get older, you don't walk around in a crutch eventually.
Yes. And thank you so much for that. That gave me so much of a better perspective because, ladies who are watching this, you're in your 30s, your 20s, and you're having any type of knee pain, you can't, like Adrian, he's helped me so much. Think long term, because I do have family members, and my family's pretty healthy, but to see them in a crutch, to see them in, I want to be 7 years old and still active, with my grandkids.
So, I think we're talking about preventative medicine, and in that case, what I suggest for people who have had issues, let's say with osteoarthritis or whatnot, or even if you're a little bit overweight and you're starting to have aches and pains, regenerative medicine helps to prevent that by doing proactive treatments in your knees by, again, Wharton's jelly or stem cells, in order to prevent that damage from occurring. So as you get older, your body hasn't aged like, I should say your joints haven't aged like your body's aging.
Yeah.
So your joints should still be relatively stable and strong. Of course, weight loss helps. Proper diet, sleeping, all that stuff. But with regenerative medicine, we're talking about prevention. So when you get older, you don't have those problems, because you don't want to be using a wheelchair or crutches and all that stuff.
No, absolutely not. Because right now, like as an athlete, or not even as an athlete, anybody who's watching this that is into health and fitness, this is something that you should always be thinking, especially if you're lifting heavy weights.
Yes, for sure.
Because it causes a lot of pressure on the
There's
joints.
oxidative stress on the muscles, and that's where exosomes might come in as well. And there's stuff like glutathione. There's all this, other stuff that we can use in order to help the body, depending on your specific issue. Like, let's say you're stressed out, again, glutathione, stem cells. Let's say you have autism or mild dementia, post-COVID, exosomes for the brain. Why? Because they go into the cribriform plate behind the eyes, through the nose, and they have easy access because they cross what we call the blood-brain barrier. So exosomes are able to get into the brain to help you with brain fog. Again, mild dementia, Alzheimer's. There's so much that's out there right now. I spoke to you earlier in the week where I went to a medical conference, stem cell conference, out in Miami back in February. And my eyes just opened up. I'm to a whole new world of regenerative medicine. I thought I knew a lot about stem cells and exosomes and whatnot. These neurologists around the world and throughout the US, they educated me.
Yeah.
I felt like I was back in college again, learning about, regenerative medicine and repair of the body. And it was just amazing. So many things that are out there.
I love that. And this is what I'm so into too, because it's one thing to be into health and fitness, into living healthy, but also I do have to understand that my body is going to be aging one day or another, right?
We're all breaking down. One of the neurologists was talking to us, after 20 years old, our body starts breaking down 10%.
Wow.
So by the time you're 70, you're pretty much just walking on eggshells.
Wow.
When he put it to me in that perspective, I was like, oh my God. I mean, everybody should be doing this, like the whole world should be doing this.
Exactly.
So interesting.
And I know this is, preventative medicine. So what is advice that you would give to somebody who's in their 20s right now that can do a little bit better with taking care of their health? If they're always tired, they're always stressed, what advice would you give to them?
I would say, honestly, 20s, 30s, most people are pretty healthy still. But I would definitely say from like maybe your 30s, definitely your 40s, you should be getting at least a treatment a year.
Okay.
No doubt in my mind. After knowing what I know and after what I've seen with the tissue repair and your organ damage, with most people don't even know they have.
Yeah.
Never mind, the illnesses they already have. All these medical conditions can be, if not treated completely, at least managed better. Absolutely. If you at least talk to somebody about regenerative medicine, talk to your doctor about it.
Yeah.
Call me. I'm
yes,
available.
absolutely.
And see how we can help you. Because if you do this to take care of yourself, think of it as a tune-up for your car. You wouldn't drive with an engine light on.
Yes.
And most people's engines are like, lights are on all the time and they're not even aware of it.
Yes, exactly. And what makes me sad is that when people get to that age, they're content. Like they settle. They're like, oh man, I have this, I have that, I have high blood pressure. Let me just keep taking my medication. And I just want to let everybody know that, if you're taking medication, that is all. And you could probably, add to this. It's a mask. It's not really like a cure to it. Right. Obviously, there's no cure, like 100% cure to everything. Right. But, if you have arthritis or any of that, find a way, peel back a couple layers. Like, what is causing that? Are you not getting into the gym or I don't know. But I would encourage everybody to not settle with the health that they're at right now, because life is so precious.
Let me give you a good example about that. Because adding on that, I had a patient about a week ago. He wanted stem cells because he had heard about them.
Okay.
He felt tired. His body, when I saw him, his body, he just didn't look good.
Yeah.
He was pale, all that. And I said, what's your health like? We started sitting, started talking. He said he had high blood pressure, and that's about it. So, we checked his blood pressure. He was at 200/90. Now, normal blood pressure, I don't know if you guys know, normal blood pressure is 120/80.
Wow.
That comes in with a 204, I think, over 90.
How old was he?
Not that old, maybe like 63, maybe, Wow. Not that old. I know most kids are like, oh my God, that's old. When you're 57 like me, 63 is not that old.
Yeah.
Anyway, so we checked his blood pressure. And so I started asking him, history is the most important.
Absolutely.
So I started getting his history. So it turns out that he had high blood pressure. He wasn't taking his medication anymore because it made him feel bad. So I said, well, why didn't you go back to your doctor and tell him that you didn't feel bad, that you felt bad? And he didn't really have a clear answer. So for the audience, first, take care of your health.
Yes.
First, make sure that everything's stable. Yes, if you've already done what you're supposed to do and you're not where you should be, then talk to someone like me, someone in regenerative medicine. But this guy, he wasn't stable. His blood pressure should have been controlled. And the fact that his kidney function was decreasing, I said, oh my God, you're going to end up in dialysis. So right away, I started him on the medicine. I said, call me if your blood pressure doesn't stabilize and we'll fix it. Whatever it takes. So we'll give you medicines to help you with, with your control. Once the control is there, then stem cells will come in and help repair what caused you to get this problem to begin with.
Okay. That is a really good scenario. I was going to ask, is he technically an ideal candidate?
He's a perfect candidate, but first and foremost, he needs to control that blood pressure.
Okay.
With regular medicines. Yes, I said it. Regular medicines do work.
Okay.
And they do stabilize. But where I come in is I help to repair the cause of the blood pressure.
Yeah.
So eventually, maybe we can even take him off the blood pressure medicines. Once we have him stable. And that's my hope.
Absolutely. Now, I would love to talk about women's health. All right.
Great.
So, I have, like I said, a lot of women viewers and hormones. How do you think can help, with a woman and her hormones?
Right. So technically speaking, most women's hormone levels tend to change in their as soon as their late 30s.
Okay.
But definitely by their late 40s, most women's hormone levels have completely changed from when they were 18 and 20. Okay. So their normal stability of their hormone levels is pretty much off by then. Stem cells, what they do is regenerative medicine, is they have to stabilize that by either forming more hormones that they need. And how do they do that? We talked about signaling earlier. That's how. Signaling. The signaling in your body tells the stem cells, we need help over here.
Okay.
Give me more estrogen. Give me more progesterone. Give me more oxytocin, which is a happy hormone. Those kind of things. So when the hormones are not stable and they're not level, the body is going to be a mess.
Okay.
And that could be anything from grouchiness to, just
Stress.
being sad,
Yeah.
depression, so many things, which is interesting because a lot of the regulation with the hormones has to do strictly with exosomes and stem cells. But where exosomes come in is more for the side effects of the mental instability. Again, depression, grouchiness, exosomes. Why? Again, they cross the blood-brain barrier. They go into the brain. They help to stabilize that. But if you don't stabilize the hormones first, everything else is nil.
Got it. And I did have a question to you about fertility because I was overthinking stuff. I was like, okay, I got the injection, but I just want to make sure and have a lot of women have peace of mind that it's not going to harm anything, right? When it comes to fertility.
Exactly. So let's talk about fertility first. So why is the relationship infertile? Is it the man? Is it the woman? Is it a mechanical thing?
Yeah.
Do you have your ovaries? Do you have your fallopian tubes? Do you have a uterus?
Right.
All these things need to be investigated first.
Correct.
Once we know that everything's there, you have the ovaries, you have the fallopian tubes, you have the uterus, and then you don't have any issues like toxoplasmosis, for example. All these things, again, traditional medicine, we have to make sure that that's stable. Once you know that it's all there and you are able to get pregnant, but yet you're still not getting pregnant, then you start dealing with hormones. Once you have the hormones stabilized by way of either clomifid or, let's say stem cells, whatever way you go, let's say you go to the regenerative medicine way, then we're talking about regulating your hormones. You've already tried clomid, say, and it didn't work. Or let's say you release too many eggs. You don't want octuplets or, septuplets or whatnot. Right. So stem cell will come in and help regulate your release of the eggs, the binding of the fetus once it's, bound. I've been successful out of 3 cases that I've had with infertility, getting their couple, to have a baby. After years and years of trying, go to Mexico, here in the US, going to different fertility places, being unsuccessful. 3 out of 3. So I'm at 100% success rate right now.
Amazing.
And hopefully it'll continue.
Yes. So ladies, look into stem cells if you're going down that path because it can definitely help you guys.
For sure.
Especially with regulating your hormones, like I said, stress and all that. I didn't even know there's so much about stem cells, just listening to you speak about that, But another question is, longevity and prevention, right? So we've talked about, being an athlete and how that can help, joint pain, high blood pressure. But for you, what do you think aging well looks like?
Right. So for me, aging well looks like, first and foremost, taking care of your body. Let's put regenerative medicine aside.
Yes.
So what does that deal with? Eating well.
Yeah.
Eating your veggies, right? Sleeping well, decreasing your stress. If that means fixing, going to a psychologist, talking about your partner and how that, you can work in that relationship to fix whatever problems you have. Those are the baseline. Again, if you don't take care of the baseline, anything else isn't going to work.
Foundation, yeah.
Traumatic relationships, childhood issues, all these different things have to do with your future self. Because if you don't take care of the base, everything else doesn't matter.
Correct.
Then we bring in regenerative medicine. What does that do? Well, again, it's repairing your tissue. It's repairing your organs. It's helping build cartilage into your joints. So as you age, you're not limping.
Yeah.
Let's say you use exosomes to help you regenerate your brain cells. Cerebral lysine. Oh my God. Peptides. All these different things come in. That's where we help to help replace the things that your body doesn't do anymore.
Yeah.
Because again, your stem cells go into a senescent mode. Senescent, again, going to sleep. Senescent means your stem cells aren't functioning anymore. So we help in replacing them.
Does that just happen naturally? Like when your cells go to sleep, like as you age?
It's a natural process. What happens is when your self is, developing, let's say you're a little zygote, you're a little fetus, and you're growing, your stem cells are in full mode.
Yeah.
They're just going.
Growing.
They're helping you form your fingers, your heart, your brain. Those stem cells are developing and specializing into heart, skin, and all these different organs. As you get older, once you're formed, they're pretty much done. It's like, what do you need the stem cells for? Yeah, you injure yourself, you fall, stem cells get released from the bone marrow, which they mostly live in. Some in the blood, but mostly in the bone marrow. So as you get older, they're like, okay, as a young kids now, they say, I'm good, bro.
Yeah.
Right?
Bye.
Bye, I'm done.
Right.
So unless you fall or you injure yourself or you have some major traumatic experience, stem cells are pretty much dormant.
Yeah.
They're pretty much, in your system. I mean, in your whole body, you might have, your circulatory system, very little. The whole body, you might have 20,000.
Wow.
You know how much you can get in 1 milliliter of stem cell vial?
How much?
100 million.
Oh my
stem
goodness.
cells.
That's why it works.
So in 1 milliliter of your blood, you might have 20 or 50 stem cells of your own blood.
Wow.
So when you're talking about external sourcing, that's why it functions, because we're able to put all those stem cells in your body by either vein or into your joint or whatever to help that immediate relief. Sometimes it does take a little bit longer. Like I said, I injected your knee.
Yeah.
Don't expect magic.
Yeah.
But it will help you, and it's going to help you. And I want to talk to you in a year and see where were you at, in July of 2026.
Yeah.
Versus where you are then.
Exactly. You did mention peptides. Does that also fall under the umbrella of regenerative medicine?
Yes.
Or is that another thing?
Yes.
Okay,
it's a sensitive subject with peptides because they're not really regulated the way, stem cells are regulated by the FDA. Peptides are kind of like a free-for-all right now.
Okay.
And unfortunately, with peptides, they are protein-based. Basically, let's talk about peptides. Peptides are basically a protein-based ingredient that we use for regulating control of your mitochondria, which are little bodies in your cells.
Okay.
So your cells have mitochondria, and the mitochondria, again, they're basically floating around, doing what they're supposed to do. Again, regulating hormones, regulating everything in your body. When those mitochondria don't work, peptides come in, and they're very specific for that. For example, you can do weight loss with them. You can do, muscle building with that. You can do fat burning. So there's so many, more than we can, talk about in this segment here. But peptides do fall under the regenerative umbrella. However, it's a free-for-all right now. You really have to be careful where you source them because I've used them, for example, from China overseas, and I didn't really see any benefit. And I bought them here, sourced in the US, much better benefit. They cost more, but they are more effective. And that's been my personal experience.
Yeah. No, I was just curious because, I do see it all over social media and a lot of people, I'm really active in the gym and they're like encouraging it, but you did say something very important. It's the source of it.
Right. I think that's the key is consider the source.
Correct.
Yeah, consider the source.
To go back to another topic, because this just came to my mind. I know that like for me, I have like 1/3 of my meniscus left, right? Which is unfortunate, but I'm very active. Now, how would that help? Because that is cartilage, right?
Right. That's so meniscus itself is actually a ligament.
Okay.
So it's not quite cartilage.
Okay.
It is more tissue.
Okay.
So stem cells can definitely help to build that as you do the treatments. So remember I told you needed a booster in a month? That's what's going to create that scaffolding to help you build on that. So the hyaluronic acid, the next step for you actually is going to be, let's talk about Wharton's jelly.
Let's do that.
Wharton's jelly is basically a derivative of stem cells. They come from the placenta and the actual cord. As they mix those two, the physical organs, not the blood that comes from it. That's where the stem cells come from. But the actual placenta and the cord, that's where you get the Wharton's jelly. So now Wharton's jelly is full of hyaluronic acid.
Okay.
So the hyaluronic acid will actually go in and help to bind the stem cells. So as the stem cells go in and they are working their little bodies around and fixing what they're supposed to fix, the hyaluronic acid comes in and it helps them to bind on the tissue of the ligament. So your meniscus right now that you have injured, whether it be cruciate, which is another ligament, is going to help you to build on, so it can actually come to a point, maybe not quite 100% of how it used to be when you were born, but close to it, and enough for you not to have pain.
Okay. Got it.
Yeah.
Got it. Now, I was just, curious because it's like, yes, I do understand that it can help me with a lot of pain, but any athletes that are interested in getting some, so you have to kind of understand also your anatomy and know what you're getting into once you get into regenerative medicine, because yes, it can help you out, but you still have to keep doing the work to
remember what I
maintain the
told
strength.
you.
Yes.
Get the injection, then take a break.
Yes.
Let your body recover from it.
How long's the break?
It depends in your situation. Like I said, sometimes I'll tell people, okay, let's stay away from any type of lower body workout. If it's a joint injection in the knee, approximately a week, depending.
Okay.
If you're a runner, I would definitely say, 2 weeks, maybe even longer.
Yeah.
Because if you go in and you start working out like you used to, because you're going to feel great.
Correct.
Sometimes they're like, oh my God, I've had people come in limping, literally with a cane, and they walk out of my house jumping. And I'm not exaggerating. I am not exaggerating.
Wow.
That's how effective it is for a lot of people. I've had one guy cry in tears because he was able to kneel down finally. He's Catholic. He goes to church and they kneel and they stand, they kneel, stand. And he was able to do that. And he hadn't done that for years.
What happened before? What prevented him
He actually was born with juvenile rheumatoid arthritis.
Oh, arthritis.
And he had already developed into a 58-year-old man with chronic pain. This gentleman is of Mexican descent, like me.
Yes.
And he was basically using crutches. He was using crutches, walkers and all that. So he came to me, long story short, I injected him and he felt immediate relief. I have him a video. It's on my website,
Wow. Yes.
activatedStemCell.com. Anyway, so he's better immediately, starts crying, he's happy, walks out with no crutches, no nothing, right? He goes home. A month later, they send me a video of him in Mexico at some party, doing this crazy dance. And I'm like, no, I told you not to do that. But he's great. He's doing wonderful.
I love that.
And he's probably I would say my most significant, strong story regarding regenerative medicine, because it was so dramatic.
Powerful, yeah.
Exactly, so powerful from being how it was to after. It was just amazing. I said, I need to record you. And I did.
Love that.
Like I said, I have him on video.
That's amazing. So it can really change somebody's life.
In his case, it was, and he's not the only one. I mean, he was just one of my most dramatic ones, but there's many stories like that. Many people that have saved from surgery because they were about to go under the knife. I said, please don't stop. Give me a chance. Let me do it. And of course, did the treatment and full range of motion, that kind of stuff.
Wow.
Just amazing. I mean, after seeing this and knowing the science, but seeing it in action is a whole different thing.
Absolutely.
Because you can read about it all day if you want. Yeah. When you treat someone and you see how now they're walking without crutches or without having to hold on to something, there's no price for that.
Absolutely. And it's sad because, a lot of people are just not knowledgeable about this.
That's what it is.
And then they resort to pain relievers, pain meds, other sorts of treatments. But little do they know, stem cells can really change their life.
Regenerative medicine is for a lot of people. I'm not going to say that it's for everyone, but I would probably say over 90% of the population that's out there would benefit from it easily, probably more.
Absolutely. I think of it as like a little energizer for your body, right? To grow more healthy cells, correct? If you want to simplify it.
I think of it as getting a new you, pretty much.
Yeah.
Getting a new you. You end up on the long term. Again, no magic here. Yeah. The long term, you basically have a new body.
Correct. I love that.
That is no joke. This is serious stuff. Regenerative medicine is a wave of the future. Yeah. And I've seen it. Yeah. I've seen it.
And I can't wait because a lot of you guys know, my background, my story, as a woman and who's been an athlete her entire life, it was heartbreaking for me to go through this twice. Yeah. And the fact that I'm in the gym and I want to push through like 4 plates, do 1 extra rep, mentally, it messes me up. Yeah. Because I'm afraid. Right. And I want to play basketball again so bad. Right. But it messes me up. You're going to get there. I know.
I'm going to get you there.
I know. I mean, dunking against her. Just kidding. Maybe not dunking, but. Right. But, whenever I'm playing, I'm afraid to cut. I'm afraid to even run. I'm afraid to even get into defensive stance because after a couple reps, it's like, oh man, I already know this whole week my knee is going to hurt. Right. But
like I said, think of it in the long term and in the long run. right now you're suffering and this is your transitional phase.
Yeah.
So right now you're getting the treatment, you're going through the resting phase right now, in fact. But once we get you done, and everything's settled and everything, I have hope for you.
Yeah.
A lot of hope for you.
Thank you. Thank you. And that makes me feel good about, what I've gone through.
Yeah.
And, obviously it was all God's plan, but I really do think this was such a powerful conversation.
Thank
and
you.
I really do hope that a lot of viewers that are watching this right now, you guys are learning. Obviously the reason why I trust you is because you're so upfront with me. You said, this is not for everybody, but you were there to actually genuinely help me out.
Right.
And the fact, you guys, he's helped me out. I feel amazing right now. This is like a real testimony. Obviously, the first couple of days, my knee was a little bit inflamed.
Yeah.
I wouldn't say inflamed, but like swollen because of the medication. Yeah. But now when I'm going up and even down the stairs, it's like, wow, I'm not even thinking about the pain. Usually I have to like mentally prepare myself to even go up the set of stairs, which is sad. But it almost has been a week and I feel great.
Yeah.
So I can't wait to work out. It's killing me right now because I want to work out.
The end message for me here, as we're wrapping up, I think is regenerative medicine is for most people.
Yes.
It's not for all. It's not magic.
Correct.
But it is effective and it is life-changing.
Absolutely.
And after seeing what I've seen, and like you said, it made you feel great and it made you feel, like I said, something it's working for you. That's a feeling that I get too. Because as, leaving, traditional Western medicine after 30 years to focus on regenerative medicine was a life-changing experience for me. Because after seeing all the people that I treated, that I felt that I was doing something for, and then now looking back, and then I was just masking.
Yeah.
It was just masking stuff, Most of it was just putting Band-Aids on, not really, caring. Now in the 12 years and on now full time for 1 year, my life has changed and seeing people and how they recover.
Wow.
And that's just been, my life-changing thing. Same thing. God has, made me, given me this new path, and I just feel blessed for it.
Yeah. Well, God bless you. And thank you so much again for being on my show.
Awesome.
Is there any way, of course, is there any way they can find you? Social media? Do you have a website?
Yes. They can call me on my personal cell phone, 805-236-2847, or they can go on my website, activatedstemcell.com. Facebook is Adrian Rojas, PA, or Activated Stem Cell as well on Facebook.
Awesome.
Yeah,
and you guys, like I said, I hope you guys learned from this episode. If you do like this show, podcast, please make sure to like, comment, and subscribe. And hey, send this to one loved one who you think this information can help them out. And I'll see you guys on my next show. Bye.